In our Family First segment this morning, there are a lot of things in the house that could be dangerous for kids.
Yeah, you don't always realize it. National Poison Prevention Week is next week. So we spoke with Dr. Elizabeth Murray from Golisano Children's Hospital about what you can do to help keep your kids safe.
This time last year, we were just getting ramped up with a pandemic, and so lots of our poison prevention information just was overwhelmed by pandemic information. However, a year into this pandemic, it is clear that that has definitely impacted the calls received by our poison centers. We know that of the 50,000 or so calls received locally, about a third were for children under 5 years of age, and the most common thing parents were calling about was for accidental exposure to either hand sanitizers or other cleaning products. The good news is that the overwhelming majority of those kids were able to stay home, and the Poison Center was able to give the parents the advice they needed to ensure their children were safe. Though about 1 in 5 did still need trips to the emergency department. So like with so many other things, prevention is going to be the best thing we can do here. So what are my tips for hopefully avoiding accidental ingestions? First and foremost, keep medicines in their original containers, including the child safety caps, to make it a little bit more difficult for kids to get into them if they can reach them. Next, this is a little bit of a different one, but actually try to limit your child's exposure to seeing you or other adults or siblings take medication, because for the younger children, that'll make it really interesting to them. And while it is important that children learn to take medicine appropriately, making it seem interesting or something that grown-ups get to do might draw too much attention to it. So when possible, limit your child's exposure to them seeing other people take medications while they're very young. Also, keeping that medicine far out of reach, so out of sight, out of mind, out of reach, are really important. I like to recommend people keeping things at least twice the height of the child, because without fail, a child's going to start a new developmental stage when you least expect it. So keeping things far out of reach in separate, even locked containers can be very, very helpful. We want to make sure all cabinets that have cleaning supplies are locked as well. Now, as we start to being able to re-engage with family and friends and visit other households, making sure that those households are again ready to have young children around.
Oh, very good advice. Well, the Poison Center is available 24 hours a day, 7 days a week. That number is 1-800-222-1222.